The World Health Organization says an Ebola outbreak in the Democratic Republic of Congo is outpacing response efforts. As Greg Palka reports, the Trump administration is now considering deploying more resources for Americans in that region.
Daily burials continue in the Democratic Republic of Congo, where an Ebola outbreak is growing.
Tomorrow, there will be more sick people coming. We are afraid. We are really afraid.
The Trump administration is reportedly expected to deploy public officials from the U.S. to Kenya to staff a potential quarantine facility there. It would be intended for Americans in the region who test positive for the disease or who are potentially exposed.
Although this poses no major threat to the general public in the United States, it is something that we have to recognize could impact the United States, and I think that's why it's really important to extinguish this outbreak at its source.
Staff from the World Health Organization are arriving in Congo today to assess response efforts. So far, there have been more than 900 suspected cases and hundreds of deaths. Local officials say there's growing pressure on the health system due to a shortage of protective equipment and attacks on treatment facilities.
Funding remains urgently needed, as well as sustained and safe access, so that responders can be protected from the Ebola virus.
And now, more countries are putting travel restrictions in place. Yesterday, Canada announced a temporary pause on processing immigration applications from people in affected countries.
We intend for these measures to be in place for 90 days. If needed, we would extend or amend or lift them sooner.
There is no vaccine for this strain of Ebola, but early supportive care can reduce mortality rates.